For me, I'm really passionate about children getting the best care that we can deliver, and a huge component of that is actually having the staff to deliver it. I'm Melody. I'm a junior doctor doing a leadership fellowship, so I'm looking specifically at workforce planning in paediatrics. I grew up in East Yorkshire in a little place called Goole until I was 4, and then as a family we moved to York. I wanted to be all sorts of things, a baker, a gardener, lots of creative things really. I'd never really considered being a doctor, but I knew I was really interested in science and potentially interested in research, and that's why I applied to go into medicine. What I loved about Hull York Medical School was firstly that there was a really friendly nature within the medical school, which for me as someone who hadn't considered medicine as a career was really, really important. I really enjoyed problem-based learning and the idea that you sat down as a group, you thought through what the problems were and how you could learn to try and address them. Also, I really enjoyed that we had early patient contact. I remember the first time that I was present for the birth of a baby at Scarborough Hospital, and that was such a moving experience. And I remember I stayed until midnight that night because I so desperately wanted to see this woman who I'd spent lots of time with. And that experience of seeing that very valued baby be born was so moving and one of the best experiences I had at medical school. Today I'm doing a workshop at the regional paediatrics conference meeting. I'm going to be presenting some of the wider issues that we face and some of the potential solutions to try and start to address them. I absolutely hate public speaking, but throughout medicine I found that one thing that's really important is using your voice for people who might not be able to use their voice, in the hope that in the long term it can do things to affect the quality of care that we can deliver for our patients. I know that there are lots of possible options for the future in terms of balancing both working with patients and doing some research, and I don't know what that will look like over the next few years, but I know that there are lots of opportunities and it's exciting to not know exactly what it will look like.